Thank you, Mr. Chairman. I'm Chang Lee from Seoul National University. It's my great pleasure to be here. Today, I'd like to talk about clinical applicable deep learning to enhance diagnosing lumbar stenosis in plain radiograph. Let's take a look at this case. Two middle-aged women present with low back pain and radiating leg pain. Patient A showed the left radiograph and patient B showed the right radiograph. Which one seems like lumbar stenosis? Choose one. If you choose patient A, your diagnosis may be based on spondylosis or decreased disc height. However, their MRI showed that patient B was diagnosed of lumbar stenosis. MRI showed perfect accuracy to diagnose lumbar stenosis. However, it is very expensive cost and limited accessibility and very long scan time. Plain radiograph cannot replace the MRI at all, but they can help with screening lumbar stenosis. These are components of lumbar stenosis. Disc degeneration was estimated by reduced disc height, so they were observed by plain radiograph. So the aim of this study is not to replace MRI with X-ray, but to create AI model that can screen patients who need MRI using plain radiographs. The secondary purpose is to find out what doctors can learn from discrimination points discovered by AI model. We included patients who took both spinal MRI and simple radiography. The lumbar stenosis group is a patient who had confirmed severe central stenosis on formal MRI reading, and the control group is the patient who had confirmed with no stenosis or no mention of central stenosis. We excluded patients who had no plain radiograph within 5 months from the date MRI, and foreign bodies such as screw cage and interspinous device were observed in radiograph. Finally, 4,644 patients were enrolled. We also performed the extra validation study. 100 patients in each group were enrolled in different study period. We divided 12,000 images into 5 subsets. Among the 5 subsets, 3 was used for my training, and the other 2 was used for evaluation and testing. The process was repeated 5 times using different combination of subsets. The performance parameter was calculated by averaging the result of 5 models in each experiment. We used pre-trained convolutional neural network architecture for binary classification. This table shows the performance metrics. VGG19 on neutral position showed the best accuracy. Its AUC was 0.92. This is the performance metrics for extra validation. VGG19 model on a neutral position also showed 0.91 on AUC. We performed multivariate logistic regression model to avoid confounding factors such as age or sex. After removing age and sex, model probability also showed 0.92 on area under the ROC curve. These figures are class activation mapping of central lumbar stenosis. It means that hand region is the characteristics of lumbar stenosis. Hand region can be divided into disc space and foraminal stenosis, pedicle, or facet joint. Feature extraction error was also observed. This is class activation mapping of a healthy control group. The AI model focused on pedicle, facet joint, end plate, and foramen. Let me introduce an interesting case. Cam of this patient focused on L45 facet joint. Unfortunately, I cannot find out the evidence of lumbar stenosis on her X-ray. However, her MRI showed that L45 facet joint was significantly hypertrophied. Back to the X-ray, her X-ray showed that hyperdense region on her L45 facet joint. So I can run that hyperdense facet joint may mean hypertrophied facet joint. So to recap, we developed AI model for triage for severe central lumbar stenosis via plain radiograph. Diagnostic power of the AI model for central stenosis was 92% on neutral position. The AI model considered not only disc height and spondylosis, but also pedicle length and density of the facet joint. This is the pedicle length, this is spondylosis, this is facet density, and disc height. Doctors may improve their ability to diagnose the lumbar stenosis using X-ray, considering length of pedicle and density of facet joint. Thank you for kind attention.